massage therapist practicing at Sage Health and Wellness. Today I'm going to do a brief demonstration on a massage therapy treatment for a very common postural dysfunction. So to begin, I want to talk about the two different types of postural dysfunctions. We have a structural dysfunction or a functional dysfunction. When we're talking about a functional postural dysfunction, we're more or less talking about the muscles and tendons and ligaments that are affected, that are either lengthened or shortened and are pulling on the bones to cause a different posture. Whereas a structural postural dysfunction is focusing more on the changes within the bone itself and how the bone will either be remodeled or how it was formed from development. So today we're more specifically talking about a functional dysfunction and changes in soft tissue. Specifically today we're going to discuss a hyperkyphotic thoracic curve. Basically a hyperkyphotic thoracic curve is an over-exaggeration of the normal curve in the thoracic spine. Most commonly we see this postural dysfunction with anteriorly rotated shoulders. Most commonly we will compose the anteriorly rotated shoulders from overuse at doing a lot of computer work or writing or driving. Everything we do is in front of us, which causes the shoulders to become very rounded. What's associated with the rounded shoulders is the over-exaggeration of the curve through the thoracic spine. So when our shoulders become rounded forward, we'll do this mild hunch in through the thoracic spine, which can cause some tension through the mid-back. And associated with this is going to be the forward head posture, which will also put strain posteriorly on your neck. So symptomatically, or what the client will present with, will be some strain in the posterior aspect of the neck. There's also going to be some strain and some tension through the mid-back and some low back pain as well. So massage therapy can be very effective for these sort of postural dysfunctions because they are mostly affected by the muscles and tendons. Massage can be very effective in relieving the symptoms as well as even just educating you on home and how you can correct your posture yourself. So the first thing we need to talk about when we're thinking about doing a massage therapy treatment for postural dysfunction is the muscles involved and what's going on with these muscles. Normally we would think the massage therapy treatment would be focused directly on the back and neck. However, it's important to understand what muscles are involved. So when we are rounded forward, the muscles on the back are going to be lengthened. So they might feel tight, however they're going to be lengthened and weak. And the muscles in the front are going to be contracted and shortened. So it's important not only to focus on the symptoms in through the back, but also to try to lengthen and strengthen the chest muscles at the front. So I'd like to demonstrate some techniques we would do for a pectoral treatment to try to lengthen the muscles in the front. So now we're going to demonstrate some techniques we would do specifically to the pectoralis muscle in terms of trying to get it to lengthen out. So first we'll just warm up the tissue. And then we'll be doing some deeper techniques where we're going to be doing some muscle stripping. So we're going to be stripping down from origin to insertion. And then we're going to incorporate some deeper techniques, some fascial work. So it's a little bit more of a friction-y technique where we're usually not using too much oil. Will let us get a better grip of the tissue. So the fascial work will be breaking up any adhesions. And we're going to bring the arm up into external rotation. And again, we're going to be working through the pectoralis tendon. And then we're going to be doing some bowing of the pec tendon. All in lengthening the muscle. It's almost like a passive stretch to the muscle. And we can do some S-bowing, again just manipulating the muscle. And some skin rolling, just try to breaking apart any adhesions. And then we just want to make sure we flush everything out. And those would be some examples of some pec work we would do for hyperkyphosis.